From 12 News, this is Arizona Nightly News.
Well, the president's signature policy of his career so far, the Affordable Care Act, is changing how Valley hospitals treat patients. It views them more like customers or even hotel guests than patients. New tonight, Joe Dana has more on how the new law could affect your next hospital stay. Joe?
Now, the goal here is to improve health care by incentivizing hospitals with, what else? Money. A key component of the so-called Obamacare legislation is value-based incentive payments. This year, the feds began withholding 2% of Medicare payments to hospitals if they don't meet certain benchmarks. Consider it a form of hospital quality control. It might not seem like much, but hospital administrators say 2% of Medicare payments is a big financial carrot in the healthcare business.
If you have an organization that has 65% Medicare and other organizations that have more, 2% can become a significant amount of money.
Whether a hospital gets that final 2% reimbursement depends on the results of nationally standardized customer surveys after patients return home.
HCAHPS has really taken healthcare and made it a customer service focused industry.
There are 27 questions like, did nurses listen carefully to you? How often was your pain well controlled? Would you recommend this hospital to your friends and family? The answers, combined with other data, help determine whether a hospital gets that coveted final 2%.
It is a little bit of a mystery. It's kind of like opening a Christmas present, not knowing what's going to be inside it.
Dr. Robert Fromm just learned in March that the hospital he helps manage, Maricopa Integrated Health Systems, would get the full reimbursement of funds for the previous reporting period. But he says there's room for improvement for next year. His staff is trying to cut down on the rate of hospital revisits by congestive heart patients.
And each day after their discharge, we make a checkup call with them to make sure things are moving smoothly. We track whether they make it into their scheduled appointment.
Hospitals are also incorporating technology at the bedside.
They also are able to order their meals.
At OASIS Orthopedic and Spine in Tempe, patients use an interactive bedside computer system that's becoming more common in Valley hospitals. The program allows patients to receive customized information based on their surgery and prescription meds.
If side effects continue or worsen,
we also push messages to them that say, have you asked your caregiver if they've washed their hands? And really empowering the patient.
Patients can also adjust room temperature without getting up, eliminating the risk of falls, a common hazard.
They also are able to share with us some of their preferences, their likes and dislikes. I like my room on at night. I like my door closed.
OASIS takes customer service even further, providing a concierge for families of patients who can recommend nearby restaurants or secure transportation, all part of a trend in hospital care, viewing patients as valued guests whose opinions matter. And now more than ever, they do matter. Now, there are critics to the way these surveys are used to reimburse hospitals. One medical blogger we found says hospitals shouldn't view themselves as hotels or theme parks, and that whether your visit was a great experience or not isn't an accurate reflection of quality care. But Lynn Sue, to give you an idea of where this trend's going, at least 2 national healthcare companies have hired executives from major hotels to help lead their hospitals.
Well, Joe, you also found out that private companies are the ones that are doing these surveys. So how do we know they aren't finessing the numbers a little bit for their clients, especially with so much money at stake?
Yeah, no kidding. That was our question. The bottom line here is we don't know for sure. There is some good faith put into these vendors. They are approved by the government, though. One company called Press Ganey out of Indiana, which oversees the surveys for Maricopa Medical Center, they had a standard statement that said that they strictly follow all federal guidelines. There are a couple dozen of these vendors around the country that oversee this, but we're told again that there are strict guidelines that they are expected to follow and that they are audited by the federal government. Joe Dana, 12 News.